a fitted sheet, then you need a drawer sheet, or you can use one of the top sheets to make a drawer sheet. You need a pad, then you need a blanket. So you come in. If the patient is in the room, depending on what scenario you have on the exam, the patient is in the room, you have to talk to them and say, hello, Mrs. Jones, my name is Lori, I'm gonna make up your bed before you go to do it. Then you do your hand hygiene, gather your supplies, and then you come, raise the bed. You don't really have to wear gloves because you're not gonna deal with a person or fluid. So just do your hand hygiene, gather your supplies, and then.
But if it's a soil bed, we put gloves on.
If it's a soil bed, yeah, you put your gloves on and clean, disinfect the bed first before you even put any sheets. Usually you will disinfect the bed, let it air dry before you come back and do the sheet. But in exam work, we're assuming that the bed is not soiled. It's not, unless your scenario says it's soiled, which you probably won't. So you bring your sheet to the bed folded, you open it on the bed, and then I can put this pillow right here. And I'm gonna put this on the bed like so. This is like one of the easiest skills you can get because you're not dealing with a person, you just make it on the bed. How hard can you get? Can't get too hard. Put that on. I always start at the top and work my way down. Voila. You try to make it as straight as possible, as wrinkle free as possible. Okay, and now get the sheet you're gonna use as your drawer sheet. Bring it. Sorry, so you unfold it. And you have it like that. That's what I was telling you guys. It's already halfway there. Put it on the bed. You see, I put it at the center because if someone was laying in the bed, this is where they might poop. Not here, not there. The big side goes up, the good side goes under. Like this. Move this out of the way so I can move around. Do my corners here on the bed, swipe it under, bring it down. The sideways are usually in the way, but you can walk around it. It's much easier if there's no sideways here. Do my corners. Bed, swipe it over there, take it back. It helps to get a bigger blanket that's big, because you need a big that spot. Tuck it under there, and then the bed is, you know, those corners. If they ask you on the test, these corners help to keep the bed flat, more flat. If you don't make the corners, the bed doesn't really get very flat. So I get my pillowcase, turn it inside out, and then I put my hand in there, the center of it, the center, and I grab the pillowcase on the side, because when you're done, you don't need this place hanging outside the pillowcase. Just put paper, grab it right there, don't wear it. So the pillowcase, you see that paper is on the other side, so it won't show. It's not supposed to hang out when you're done. So I'm done with my skill. You can leave the bed in the highest position, it's fine because there's nobody in the bed. Yeah, I'm done. Yay. Yes.